I'm Mary Rudolph. I'm Professor of Public Health at the Faculty of Medicine in the Galil. We're sitting in the Child Development Centre of Tsfat Hospital. Tsfat Hospital is the local hospital for the Tsfat area, and the Child Development Centre serves children from across the region, mainly on the east of the Galil. The Galil is in the north of Israel, and it's really the most disadvantaged region of the country. First of all, the life expectancy of people in the Galil is some 8 years less than in the centre of Israel. The infant mortality rates are higher here than they are in the centre of Israel. Every mark of health is worse. For example, diabetes and obesity. There's more diabetes and obesity in this area of the country. The Faculty of Medicine in the Galil was set up with the political vision that placing a medical school in the region would bring about health and prosperity to the region, or will contribute to health and prosperity in the region.
As part of the medical school, it is very important for us to incorporate technology into the curriculum from day one. Not something we're going to see in the future, but right now. Hopefully we'll get doctors that are well educated and are aware of all the technologies that are available for them to be better doctors. We're not just a medical school, we're part of the community of the Galil. Another thing that was set from day one of the medical school. We had one event that 1,000 kids showed up. We opened the labs, we gave lectures. It was amazing for us, it was amazing for the kids. It was really heart-filling. We have school children coming over, learning about the human body, learning about diseases, learning how to eat healthier. They were asking questions, they were very interested in how our body functions. And these are the seeds, these are the roots that we're going to build as far as we can reach.
The UJIA has actually helped build the medical school. It's continued to have ongoing support. There's huge interest in the work we're doing with the aim of making a difference to the Galil. It's just so varied. There's Jews from right across the spectrum and Arabs from across the spectrum. And I really think that the UJIA's approach to this is remarkable. It's not just aiming to improve the lot of Jews in this country. It is working right across all the population with the vision and the understanding that it can only be good for Jews here if it's good for everybody in the region. It's very important to us that they really understand the communities where they're going to be studying and working. They're working with organisations, they're working with some of the most disadvantaged people, the elderly, the disabled, children at risk and so on. And they also are required to do a piece of academic work around it so that we make sure that they understand the needs of the population where they're working. And I think this is quite a unique feature of a medical school, probably anywhere.
It's amazing that we started 3 years ago and already we have more than 300 students that are working in the community, that are involved in the community.
It's a pretty tall order to think that a tiny medical school can really impact on health and well-being across a region. But it's really already happening, and there is a difference. Certainly there's an upgrading of facilities in hospitals and clinics, but that isn't really what it's about. The medical school is bringing a buzz, for want of a better word, to healthcare in the region.
Ultimately, the story of the medical school in Tsfat isn't just about the quality of healthcare and the improvement of healthcare, but it's about how this is essentially a game changer for the entire region in the longer term.
There's a real probability that the medical school is going to make a dramatic impact on not only on Tsfat, but more widely across the whole of the Galil.